The definition of nursing is the provision of care to individuals of all ages who may be sick or well in the prevention of illness and the promotion of health. Within this definition itself, we hear the term individuals, which implies people or patients. The use of simulation is a growing trend in nursing education as a proposal to bridge the gap between theory and practice. As education has moved from practice setting to classroom, there has been a growing experience of new graduates showing up to the workforce grossly unprepared. While the evidence does indicate that simulation is effective at building clinical skills and confidence, it does not indicate that it is any more effective than completing the training in a clinical placement. Learning and knowledge transfer occur best when in a realistic environment. With this knowledge, how can it be argued that learning can occur any more effectively in an unrealistic environment? Despite the fact that growing technology can create high-fidelity simulation experience, the evidence still shows that high-fidelity simulation does not always lead to effective learning. With that in mind, we have to consider that even with the best technology, it does not account for the natural variations that occur among people. For example, if you're starting an IV on a 90-year-old dehydrated male who has skin that feels like tissue paper, in comparison to a 20-year-old male who's relatively healthy, it's vastly, vastly different. While it is useful to practice on a mannequin the steps of opening all of your equipment, it still is not a realistic experience because you're probably going to get that IV start every single time because you know where those veins are. Additionally, it is challenging to form a therapeutic relationship with a mannequin, even if it is high fidelity and able to speak back to you. As we know, there is 93% of communication that stems from nonverbal communication, and a mannequin does not have the ability to give nonverbal communication to you. So that means we're only receiving 7% of the message of this patient. While the benefit of simulation learning is that students are able to practice their skills in a safe and controlled environment, the reality is that nursing is anything but controlled. You cannot predict what sequence of events may occur as you're performing a task or duty. And a huge portion of nursing care is learning how to prioritize and time manage. And this is something that cannot be taught in a simulation setting. Moreover, despite being able to practice in this controlled and safe environment, there is no indication in the literature that this is an enhancement to patient safety. Finally, if nursing education determines that it's just as effective to teach our new students skills in the simulation environment, just imagine for 1 minute how you would feel if a new graduate were to take care of you or your family member, and how confident you would feel in their skills knowing that they had only been trained on a mannequin.